Today, I am talking to you about one of the most painful memories of my medical profession. This is year 1981. Rajendra Hospital and Government Medical College Patiala Department of Surgery. I am myself here, a postgraduate medical student. This is a young lady, 30 years old, and this is her husband, almost of the same age. And this is 3 months old baby in the arms of this man. And tears are dripping down. With this sad face, he is standing here weeping. And I am here talking to him. This lady is not dead, she is alive. I am being a postgraduate student. I am conducting a research. This is the thesis which was submitted and approved by the university in 1982. And the topic of this thesis is fine needle aspiration cytology in the diagnosis of lump abdomen. That means a swelling inside a lump which can be cancerous or non-cancerous, a pus or tuberculosis inside the abdomen. And fine needle aspiration means that a normal syringe and needle which is used for intramuscular or intravenous injections, that is poked inside without any anesthesia just after putting some spirit swab here, and I draw little bit of material from that swelling, a tumor, and that material will contain some cells, or if it is infective, some bacteria or pus cells, or some cells of the cancerous or non-cancerous growth. And that I will make into a slide, and that slide I will stain, and then I will under the microscope about magnification of 100 times, I will study the stained one to try to find out what is there. So this lady had come to me after delivering this baby of 3 months age. She had started noticing a swelling growing very rapidly in her abdomen. And normally after the delivery, the abdomen goes back. And during the delivery, due to pregnancy, she had a hump. She couldn't notice that swelling. And her weight was going down very rapidly. So this brought her to this Government Medical College, Patiala, where I was a postgraduate student doing my surgery residency under Dr. Amarjit Singh, Professor of Surgery. And my topic, thesis research topic approved by the university, was to draw from a syringe and needle some material from her tummy and to study myself under the microscope after staining. And then I found that this looks to be cancerous, because as I will show you that this is the slide under small magnification and under high magnification. So these cells are mostly composed of nuclear material, that is called hyperchromatosis, and they are stained very deeply, and they have lot of mitotic figures. That means they are very rapidly growing, and there is very little cytoplasm, means cell fluid outside the nucleus. The nucleus are very big and hyperchromic. CE value is like very less. The cytoplasm is less and nucleus is too much there. And they have mitotic figures which are dividing cells, and very high genetic material. So this made a diagnosis of malignancy and that of a sarcoma. Now I had then to compare it with the traditional method of opening the abdomen under anesthesia by a small incision and if possible try to take out entirely the tumor and if not possible to take a small piece of it and submit it for histopathology failure, like if there is a cell we study the cell like you saw there, but if that is a material like a piece, so big piece into that is cut into slices and then we study that slice, the constitution of how the cells constituted, how they're together. So those histopathological biopsy studies, both they came out to be leiomyosarcoma. During the surgery when I opened it, and I found that there is very well spread, spread all over the abdomen. The intestine, small, large, omentum inside the abdomen, everything is covered with a very soft type of growth, which is breaking and with my examining figures. And there is a chance of massive bleeding. I called my professor and he saw it. He said, Narotam, this may bleed very profusely. We cannot remove it. So you close the thing after taking biopsy. So I closed the abdomen. And then the report came. Now, then when the report came, at that time in 1982, there were no CT scans, there were no ultrasounds even. But even if they had been there, they were useless because in this case, the leiomyosarcoma, which is very rapidly growing cancer and of the smooth muscle, that we couldn't do anything about that. There is very, even today, there is very little chemotherapy or radiotherapy for it or immunotherapy. Uh, this is one of the killer type of thing. And young lady with a small baby, and I came in between all this scene, a very, very sad scene. I still remember standing in the ward and in front of that person, and he is carrying with great love and affection 3-month-old girl child and looking towards his wife and asking me when will she be all right. And I had to stop for some time and then tell him that we couldn't remove the tumor and she's not going to survive for long. Sorry. And then we stood, watching each other for some time silently. And then I just gave my love to the child and put a hand on his back and said, see, it's the will of God. The science is not that much developed to be able to help you that we can cure this patient. And when the wound will be healed, after few days, you can take her home. That is really very sad. And this is what the story I share with you, the failures and sadness of my medical profession.